Hi friends, today we're going to discuss about the very commonly used suturing called subcuticular suturing, where you don't really see any suture outside and is very cosmetically very efficient, and especially for children or people who are conscious of their scar, it is very useful. Undyed one, so that there won't be any discoloring happen to the skin surface, especially if you are in the Western world, try to avoid any colored suture. Okay, come near to us. Tell you something I learned over a period of time to use very effectively every single bite, not to waste any of your time. So here you just come just below the skin surface and one side here, hold it. Normally use very fine instruments here and turn it around. I learned it while doing a plastic surgery type of work in London with one of the teacher who does a lot of breast reconstruction. So you just come below the skin surface here and then you pull it out and you make a knot here. So by doing this one, this even first stitch itself, somebody will use a different knot which could be very lumpy and looks ugly. So it just comes very exactly there where you want, and it brings the edges together very nice way so that you don't really waste even the first bite. Once you've done that one, you can just divide this bit. Long wound or more than 5 centimeters or 6 centimeters, you can go for straight, otherwise curve will be very good. So you go to the surface here, it is going like a triangles here. You need to take a good bunch of tissue. Here is not real, but you need to have a good tissue, not only epidermis. That is what one of the mistake you will see. People very superficially, the wound edges doesn't really come nearby. And normally, because the curve is like this, I will go a millimeter or so behind that one. I'll just creating like triangles here, go here and then. So like this is like that. So I will again show that one, the technique. That is the master of subcuticular suturing. When you hear it is like step ladder. This goes like when you pull them together and the wound edges come very near nicely. They'll come very near. So if you do it properly, subcuticular suturing, it just gives you best cosmetic result. So can you see this is coming here, and this is a very important crucial step here, and then you go a millimeter or behind and you take good chunk of tissue and it's going like in a triangle, so that you have good amount of tissue in that bite. Otherwise it doesn't really look good and it doesn't really get the wound edges properly. So every time you go there, and if you suppose if you come exactly here, because the curve there it just goes a bit further up, so the actual trick is just like go a millimeter or two behind, and then you create good triangle of good tissue. So you take both epidermis and dermis together and you pull it out. And when you're holding, do not hold the tip. So again, you just get one third and two thirds as usual for most of them. And when you pull it, and that is what is the beauty of this one. So it comes exactly opposite here. So when you do it properly, you see like you hardly see that any gap is there between the switches. So this is the art of suturing, and nurses will be very impressed if you do good suturing. So some people say like you need to enough of time. Whatever we do inside doesn't matter, but patients, they will look into the outside wound. So normally most of the times the senior surgeons will do all the important bits and they will give it to the junior doctors or junior residents. And if you know that how to use it and the principles of the surgery, and this is your shop where you can do this one. So if you come here, so it just comes very nearby. Dear friends, you can see that's almost very hard to find whether have done any wound is there. So if you do it properly, you will get very good results. So you need to put enough of time. So when it comes to the end there's different ways of this terminating the wound, and almost needed to that. So it's a smaller bite. And you come there, you pull it out, and here you're terminating the wound skin. So you just use this. This is called Aberdeen's knot. 1, 2, 3. And most important thing is once it's done, it has to come through this. This is the most important thing. If you don't do it, is all whatever the work you've done, it just will just go in vain. So can you see that at the end, if we come close by, if you come close, but there is a knot is there. You want that knot to be buried. So you just go to the very edge and then you come far from that wound like this, and you drive it further and then pull it down. So if you do that one, that knot which is there, that will be buried. You see, that's the beauty of the little small techniques which will help you. This is all done. So when there is a little bump there, I normally use a swab to just know if you just make it like this, all good. Okay, so this is one of my favorite topic of subcuticular suturing. If you done well, and you will get good appreciation from not from the boss, even from the patient, they will appreciate how nicely the scar is done. Thank you very much.